while we're still on the public market, what do you think about Abivac's IPO? I mean, Abivax, they managed to raise 200+ million.
Yeah. So again, I think that if you've got a story that resonates, and again, people understand now because of COVID, etc. People got a much better understanding of vaccination and the value of vaccination, etc. So I think that 5 years ago it would be more of a struggle than it is now, because people go, vaccines. Effectively, vaccines good. Yeah. So I think that, but I don't think that's the
it's all
that's the window is open.
Yeah.
I think that's what we're going to see.
It's quite surprising to see it in that timing. I mean, it was surprising to me at least to see that they managed to raise that much right now.
Yeah, I don't know the thing. It's not anomaly. I don't know how many insiders were involved. Yeah, because that's one of the things that you would. Yeah, if I was now a journalist and I was sort of analysing that deal, I would look and sort of see, like, okay, so how much was floated? Did it go out at the price, or was it at a discount? And how many insiders actually participated in the round?
It was a big part of it.
So there's a whole bunch of. So I saw it, but I didn't necessarily look into it in any great detail.
I mean, Sophie Nova is behind and put quite some money in, but there's some US crossover fund who also put, but also the market. And I think after trading they were at minus 15%. Yeah, just after the first day, so
that's it.
Which is a sign also the kind of market corrected as well. But so, but what's just thought about this? If we go back to the definition of biotech as well, I mean, we're taking a bit of a loop, but towards also what's happening today. Now you have biotechs who make money. Yeah, and we still define them as big biotech or biotech. Let's say, whatever. I mean, the BioNTech in Europe, you take the BioNTech, the argenx, etc. Also Moderna in the US, but it's funny also how do you just from the term, how do you define them?
Right. So I wouldn't call them biotechs anymore. We call it biopharma.
Okay.
Right, which also, some of the pharmaceutical, in fact, now most of the pharmaceutical companies have a huge molecular biology.
Most of their pipeline is also 80+% is less biotech.
But even 15 years ago, there were I mentioned people like SmithKline were clearly on that route, where others were still very much firmly wedded to the small molecule and weren't necessarily involved in the sort of the molecular biology and the biology, whereas now they all have to be.
But you get to the biopharma world, then you have then it's basically conflicting with the mid-cap pharma who all call themselves biopharma. So there's, let's say, Ipsen, Servier, which for me is very different from a Genmab is very different from a Ipsen, for example.
Yeah. And therefore so again it's kind of, because obviously we always had to sort of like find some sort of like jam jar label that you could give these companies, because you're right, there's almost like sort of what's your middle strata or whatever. There's a where this sort of mid-tier of people like Ipsen, Servier, Almirall, and they tend to they've either come from a sort of like a private foundation. Lundbeck might also fall into this category, and have been located at, in a region, and they've supported that region, but never really globalized. So like Ipsen now has got global ambitions. A lot of the Japanese companies were Japanese, and now you've got people like Takeda, Astellas.
Daiichi, I mean,
these guys have now sort of taken a much more sort of global view. So those, again, it's one of these sort of so mid-sized pharma is how we would necessarily describe, or sort of a regional player, like, so like Spanish pharma or Italian pharmaceutical company or whatever. Then we have, and I've heard, for example, BIO, the Biotechnology Innovation Organization, it came up with almost like how it was split in the market for what we would call biotechs in terms of R&D stage companies and clinical stage companies, to again sort of differentiate that.
And then revenue stage are profitable. I guess.
Yeah. So
they were not
basically commercial stage.
Yeah, commercial.
And that's the and it's part of the evolution. So it's a way of always stratifying.
Yeah.
So it's like we're all humans, so we're all biotechs, but in fact, what kind of when we actually deep down and we start stratifying it. So but you've got are likely to sort of be sort of end up with Alzheimer's or whatever. You can sort of stratify it that way. So I think that actually, what's in an egg? A rose would smell as sweet by any other.
I was about to say, but I was just curious to hear your definition and from seeing also these terms evolve over time.
Yeah.
And where you are so at the end of the day, I agree with you. I mean, it's just a word. It tries to encompass something and to help when you hear a word, but it's not 100% definition.
So going back, it's like when I was at I was a science and technology editor at European Chemical News, and I was writing about biotech. So writing about cell tech, right, which was had originally been backed by the MRC. It was an MRC chief. All the science had come from the MRC. They had a sweetheart deal with the Medical Research Council of the UK. And I was working on European Chemical News, which was basically focused on petrochemicals. And ICI was the bellwether of the UK economy. It was the biggest company on the FTSE 100, etc. I remember one of my colleagues sort of said, "Why do you write about this thing called cell tech? Like, who cares?" And I sort of then said to them, one day cell tech will be bigger than ICI. Now, what happened is in '92, ICI then sort of split into its like chemicals business, and then it split off its life sciences into what was Zeneca, which then became AstraZeneca. And over time, I think it was the next 5-6 years, chemicals became less and less important. So because ICI actually became smaller. And then one day, the cell tech actually got into the FTSE 100. This was before it was acquired by UCB. Got into the FTSE 100, and I phoned up my former, just talking about
you owe me a beer.
That's what I said. I told you it would happen. So
let's go to the pub and you owe me a beer.
Yeah, exactly. Yeah, remember that bet? Good.
That's the good one. And stay on this big biotech or biopharma. I mean, I think that's a really interesting development that, I mean, it never happened within Europe where you have like biotechs who are still like standalone companies, let's say. I mean, Genmab, Argenx, BioNTech were all worth north of more than 10 billion and making billion euro revenues and are profitable and are still like as a standalone. And this, it basically never happened. In the last decade, this happened. Before, never really happened.
No. And so
let's put Actelion as well in there, which was already profitable before being acquired by J&J. But basically, it's like a handful of companies who made it commercial at a billion level, in dollar or euro level, and being profitable.
And also, what do they all have in common?
When biologicals, most of them, but
they're also European.
Yeah. I'm focusing on the Europeans, but
so the UK. No. So I know because we're not going to go down there. But anyway, that route. But so the UK actually has always struggled to create businesses of critical mass, because they get to a certain level and then also they just then get acquired.
Yeah.
And, and that's a shame. And I think that, you look at, and you mentioned Sofinova. Sofinova were a big backer of, Clausel and Actelia when it was first created.
The first,
Right? And I think Antoine was probably on the board.
Yeah, he was.
Yeah. And you look at some of those other, Argenix and, Ablinks.
Yeah, but they got acquired.
Genmab. These companies, they were backed by what you call clever money.
Yeah.
And actually by VCs who actually are patient.